The National University of Science and Technology, NUST, joins the government of Zimbabwe and the rest of the world in the fight against drug and substance abuse, which has been declared a national disaster. Despite efforts through law, regulation, and policy formulations, the economic and social impact of the menace continues to be felt locally and globally. To win the fight against drug and substance abuse, it is critical to understand the scope of this problem. Let us hear from an expert, Dr. Nemashe Mawere, on the background and types of substances commonly abused.
What kind of substances are people using? In this country, in Zimbabwe, generally alcohol is the biggest substance which is used. It comes in the form of the formal beers and spirits which are made, and also we have the illicit alcohols, the njengu and the tumbra and other stuff which we are getting imported from. We don't know where they are being imported from. Some of them are being made by people. I've heard that people actually take ethanol, 100% ethanol, and dilute it a bit and sell it as somebody. So people have been really trying to do a lot of things with the alcohol. It comes in different preparations and it's widely available, and it's accepted that people can actually use alcohol in society. But then obviously people have started using more. So that's where the problem comes. We need to identify why do people end up using more. Same thing with other substances. Cannabis, we've had cannabis. A long time ago, people used cannabis of a very low concentration of the tetrahydrocannabinoid, which is the active chemical in the cannabis. So when people were using that stuff, particularly in the 60s, we can see the hippies, they were doing their things. They were also use of this low concentration of cannabis during those days. But now you find people are using higher concentrations of cannabis which has been made in the laboratory called the skunk, which is also widely available, and it's causing more problems, and we are having a bigger problem on our hands. We also have other substances like the stimulants. The stimulants, mainly the stimulants which we have is the mtoriro or the crystal meth, which is also widely available, particularly in the urban areas. They always say the crystal meth is the poor man's cocaine. So crystal meth is also widely available as a stimulant. We also have other stimulants like your caffeine, which you find in your energy drinks, and your nicotine, which you find in the tobacco, which is mainly smoked, and of late people have been using vapes. So these are the substances which you are using as stimulants. There's also ecstasy and other substances which you have to find in the places where they are found. And of course, cocaine is very expensive, so you don't tend to see a lot of it around. And then we also have drugs which are depressants, like your benzodiazepines, mainly the diazepam. The diazepam, we've got a very interesting variant of a diazepam which comes mainly from Zambia and other foreign countries, which is a 10 milligram. We normally, our tablets are 5 milligram tablets, but we've got 10 milligram tablets which are coming from these foreign countries. And when people are using them, they end up also getting, we'll talk about the dependence, what you call addiction. We'll talk about that later. But people end up getting addicted to this diazepam in a bad way, in such a way that when they come to the casualty, they want to be helped. You find they are already using maybe 5 times the normal limit which we think would actually kill someone, and they're already using those kind of quantities. So we are really sitting on a big problem.
Dr. Mawere has highlighted the widespread nature of substance abuse, with a range of substances being misused globally. These include alcohol, opioids, cannabis, cocaine, and synthetic drugs, each with their own unique effects and risks. Substance abuse is a complex issue that requires a multifaceted approach. Addressing the root causes, providing access to treatment and support, and implementing preventive measures are all crucial in tackling these significant public health challenges. Together, we can raise awareness, promote education, and work towards a society where everyone has the resources and the support they need to overcome substance abuse and lead healthier, fulfilling lives. Let's take action and make a difference in the lives of those affected by substance abuse.
Good morning. My name is Dr. Animacha Mawere. I am the Chief Medical Officer at Inguchen Hospital. I work there as a psychiatrist who looks after mental health patients, particularly those who have been affected by substance and drug use problems. I'm also working at the National University of Science and Technology, where I'm the chairperson in the Department of Psychiatry and Social Behavioral Sciences.